Let's clear up the courts. Florida judge rules that adult gender-affirming care ban still in place while being challenged. A federal judge ruled that the new Florida law restricting health care for transgender people can still be applied to adults while it is being challenged in court. Judge Robert Hinkle, who previously blocked the law's enforcement on behalf of minors, ruled that adults seeking to expand his injunction haven't proven they would be irreparably harmed until the case is resolved. The law signed by Republican Governor Ron DeSantis in May bans any transgender treatment for minors and requires transgender adults to give a consent to treatment in person and with a physician present. Advocates say this is a problem because much of the care is prescribed by nurse practitioners or through telehealth, and that it's too hard for many patients to get in-person appointments with physicians. Florida is one of 22 states to adopt the law in the last few years banning gender-affirming care for children. But unlike others, the one signed by DeSantis, a candidate for president, also has provisions aimed at care for transgender adults. Transgender adults in Florida are facing tough choices, including whether to uproot their lives so that they can continue to access gender-affirming care. Clinics are trying to figure out how to operate under regulations that have made Florida a test case for restrictions on adults. Now, this seems a little scary for adults to me because I know once you're kind of in the transition process or you have these kind of hormones prescribed to you, you really shouldn't get off them. And I don't know what the repercussions are at that point, but I'm assuming then these hormones aren't as effective when you get back on them.
You have to start all over. You have to start all over, basically.
So it's going to be tough for them to finish the transition. Obviously, their hormones are going to be off, which means their levels, the way that they act, the way that they feel, the way their emotions are perceived and how they perceive things is going to change a bit. And that's a little dangerous for society at large as well, if we're really honest about it.
Yeah, no, it's scary times. And you folks know that my wife is a nurse practitioner. So this just recently went down that they no longer can prescribe gender affirming meds, right, to trans individuals. And so everybody knows that there's more nurse practitioners than there are doctors. Okay. Oh, yeah. Everybody knows how hard it is to get a doctor appointment, right? When it's like, yes, life or death. I feel like crap. Okay. 2 months from now is our next appointment. You know, the reality is that South Florida is also very horrible when it comes to transportation. Our public transportation is one of the worst in the nation. Okay. And our trans brothers and sisters can't just go, and get to these medical appointments that they so need to. They're making it harder and harder. Okay, exactly. So people will have to get up and leave if they want to continue to be their true, authentic self. And it's effed up.
Why they're making it so hard? They want them to leave.
They want them to leave. Yeah, they want them to leave.
It's the only possible explanation because there's no reason to interfere with another person's adult health care. There's just no reason. Yes, you have to get a vaccine because you're going to be around other people. You could spread measles or Mpox or whatever, but you're not spreading anything. There is no benefit to the state. There is no threat to the people to ban transgender people from getting the health care they need. It's pointless, it's dictatorial, and it's so incredibly invasive.
Yeah, it's fascist. I think there's two important issues in this story that are really important that we draw attention to. First off, the judge is saying that you haven't proved harm yet. And what the judge is saying, the federal judge is saying, is there's no standing yet to stay this, to not enforce it while the appeal process is going on, which is what the judge has said. Now, this in and of itself is not bad because what the judge is saying is find standing, find someone that is harmed that creates standing for this case, and we hear the case. That's what the challenge is from the judge. They most certainly are going to find standing. They are going to, because there's going to be adult people that identify as trans that are in this kind of healthcare program, and they're going to find harm for it, which is what the judge is asking for, standing. That's one issue. This is not absolutist from that standpoint. The other thing that's really critically important in this story is 22 states have said that children, minors, cannot participate in hormone replacement or other gender-affirming care. Florida is the only one that has said, and this is the big asterisk, the big point, is the only one that said adults can't do it. Medical professionals can't do it for adults. So Faye, let's just assume not, but Faye is going to transition. And at her point in her life, the doctor participates in prescribing gender-affirming medical care. Faye can't, at her station in life, at her age in life, as an adult, as a decision maker of her own body, she can't make that decision, and the doctor can't make the decision. Florida is the first state in America that said, no, you can't. Now, this will certainly be struck down, because could you imagine that same decision making applied to testosterone for men, or to obesity medication? No, the doctor can't make a decision for an adult to prescribe obesity or other kinds of medications that would affect you physically. It's impossible to believe that the courts will allow that to stand because of the equal protection under the law. It's not going to stand. Florida is the only state in the country that's done it, and the only reason they did it is because we have some radical running for president of the United States. It becomes red meat for the base against the former president of the United States.
Yeah.
That's where we're at. We have to work through this process, but we will work through this process. We'll find standing, and then the judge is going to do what he does in terms of the stay and say, no, it's unenforceable, and it's going to work its way through the courts, and the courts are going to say, this is unconstitutional.
Okay, but how many people will die in the process?
Where?
How many
how
people
fast are
will
we gonna
move
get
out
there?
of
Yeah.
Florida? Okay, how many friends of ours will we lose in the freaking process?
That's the
for
sad
votes.
consequence of this decision making.
And
Both.
he's appointed people in control. So as much as we say the judges aren't going to go for it, he's appointed some of the judges that make these decisions. So as unforeseeable or unbelievable to think that could happen, anything we've seen in the last 6 years can happen.
It is unimaginable. I'll crawl out on the limb. It is unimaginable to me that the Supreme Court would sustain Florida's law that an adult and a doctor with an adult cannot prescribe gender-affirming medical care. Because the moment you grant that, then the state can make decisions about everything to do with medical care from a doctor and an adult deciding that they need that. And the moment they do that, we have kicked the doors wide open for fascist authoritarianism.
No more Viagra for you boys.
And
they would never pull back.
That's a great example.
But it's the truth.
It is the truth.
Why
It was-
should you be able to get your dick up, okay? And you can, and she can't get the gender affirming care she needs. That's not fair. You don't need your dick to be up.
Go to abortion.
And fairness, just in clarity, in my opinion, you hit the right word. Fairness is the right word, because constitutionally you can't manage a clinical medical decision for John differently than Faye, and for Faye differently than Jonathan. That is unconstitutional. And the moment the Supreme Court says you can do that, oh my God, we've got all kinds of really greater, terrible problems on our horizon. I can't imagine that they would do that.
Well, I hope you're right, because I'm not as optimistic as you when it comes to that. Just after watching the abortion and people being able to control their own bodies and make their own decisions, which as adults.
We are Queer News Tonight, the world's first and only live daily LGBTQ+ evening news show, brought to you from Happening Out Television Network. We operate in the same model of PBS and NPR, but for the LGBTQ+ community. We educate, inform, and entertain by supporting the 10 pillars of our LGBTQ+ community, with more than 100,000 a week watching us on Roku, Apple Television, and other channels. To keep the story going, we accept donations with 100% transparency. Stay updated and live authentically with Queer News Tonight.